the question you're probably all tired of answering already. The Canadian study, followed by the New York Times article, followed by what's being termed the Great Mammogram Controversy. And I know that in Miami last week or sometime earlier this month, it was discussed in some consensus response. Could you share that with us?
I've always wanted to get Peter to have to answer a question as a matter. You want to do that one, Peter?
I'll take a stab at it. I'm probably not the best person for this, as I'm a card-carrying oncologist and don't think quite so much perhaps about screening, but I'll just, I'm sure some others will add to this. The Canadian study has, there's been a lot of controversy about it. A couple of issues are important. One, there's been a lot of debate, and the study actually was first reported over 10 years ago, but there have been a lot of issues about the technology that was used, the training of some of the technologists and radiologists as well, and some of the quality controls of the equipment, if you will, or the level of technology and of the mammography units that were used. And so that's one area that's been very controversial. And another aspect of that study is that there were, not consciously, but biases probably introduced into the study. Women were registered to the study, enrolled after, a number of them, after they were found to have a lump in their breast, so what we call a palpable mass. And it appears that that had some influence on the randomization process. And so that's been an area that's been very controversial. So a lot of experts in screening mammography have a lot of, how do I want to say this, a lot of concerns and feel the accuracy of that study is quite limited. So,
I think Angie wants to make some comments for sure.
Just to add to what Peter said, I mean, I think if this mic is working, actually, but can you hear me? Yes. So the crux of the issue is, should women who are between 40 and 59 have mammograms? So should younger women have mammograms? Does it really work? And there have been lots of studies actually looking at this, and there was a large, what's called a meta-analysis, where they put all of the studies that had been done so far together that did suggest that those women in that age group would benefit from having screening mammograms. And so there's something called the U.S. Preventative Services Task Force in the U.S. that looks at all of this data and makes recommendations, and that's really where the recommendation to have women have mammograms starting at age 40 came from. But the Canadian study really calls some of that into question. It was a really large study, and it does have the caveats that Peter talked about. But I think that one of the things that we really have to ask ourselves is, if we are finding things on mammograms that might not have hurt the person had they not been found. And so the controversy isn't, should we try to find breast cancers with mammograms, because they do work for older women, particularly women with less dense breasts, but should we go looking in women who are at less risk, women who are younger and have more dense breasts, and if we find things that wouldn't have come to light before, are we giving treatments that might be harmful to someone, even though that breast cancer might never have hurt them? And so this issue of over-treatment and over-diagnosis has become a big controversy. And part of the problem is it's really hard to know which cancers are going to go on to become problematic and which cancers would have sat there and done nothing over a long period of time. So it's really spurred a lot of research to understand the biology better. But the U.S. Preventative Services Task Force has not changed their recommendations based on the Canadian study. So we still continue to follow those recommendations, but I think that it is healthy for us to question whether we do need to continue to do mammograms in everyone in that group, or we can find the higher risk women who have more to gain from doing it and less to lose.
In a second, these are two wonderful comments. There are two additional comments to think about this. One of them is extremely good news. When you think about it, detecting something earlier usually meant because you could cure it then, but you couldn't cure it when you found it later. So eventually, if your treatments are perfect, early detection might be meaningless, as a good thing, if you follow what I'm saying. And that is certainly true. The Canadian study is somewhat more recent than some of the others, and with the use of adjuvant treatments, which may be arduous, but nonetheless are extremely effective in improving survival, possibly catching things a bit earlier becomes somewhat less important. Having said that, when you think about lumpectomy and breast preservation, waiting till someone has a bigger lump, even if you can cure it, might not be the best cosmetic result. So I'm certainly not going to turn away from mammograms for my own view yet. But the end game is they should become meaningless if you have really effective therapy.
Yeah, I guess there's another point that had been raised this year was also without talking about cancers that won't harm you, the other issue is that what is the harm of a mammogram where you need a biopsy or a callback, and how much psychological distress and how long that lasts. So I think there's great controversy about that. Some very small studies suggest that there's great distress. Larger studies in a recent meta-analysis said that many women are able to recover from that and really not have much in the way of long-term consequences. So all these three arguments are mixed together.
Perfect. All right.